करना पड़ेगा क्या इसमें? नमस्कार सर।
म्यूट कर दो। हेलो,
सर नमस्कार।
नमस्ते।
we will start the session, sir. We're waiting for you only.
I am there on the platform.
Okay, sir. तब दिखना है ऐसे करो.
But there are still 2 or 3 minutes to do, so you can wait for 2-3 minutes.
Okay, sir. जरा पूरा स्क्रीन दिखना है सभी पार्टिसिपेंट्स दिखने के लिए.
Hello.
Hello, madam. How are you?
Fine. How are you, Shansa?
I'm fine, madam. Nice to hear you after a long time.
Then we can see the face on the screen.
Yes, yes. Okay. Shravani, please start the seminar.
Yes, everything is okay?
Yes, yes, madam. Everything is okay. First, we will start with the this thing prayer and inauguration, and our director's speech, and after that will be your presentation, madam.
Okay, okay.
Good afternoon all. On the behalf of Shalakya Tantra Department of NIA, Jaipur, myself Dr. Shravani Gavande, welcome you all to the national webinar on practical approach in Shalakya disorders on the occasion of 5th Ayurveda Day 2020. Organized by PG Department of Shalakya Tantra NIA, Jaipur. I feel honored and indebted to our Honorable Chief Federal Shri Shripad Yashonayak Sir, Honorable Union Minister of State, Independent Charge, Minister of Ayush, Government of India, and our Honorable Padma Shri Vaidya Rajesh Kotecha Sir, Honorable Secretary, Minister of Ayush, Government of India, for providing an excellent platform for organizing this event. Organizing Chairman, respected Professor Sanjeev Sarma Shah, Director of NIA Jaipur, for his motivation and dedication towards this institute. Our Organizing Secretary, respected Professor Samsha Fiaz Ma'am, HOD of PG Department Shalakya Tantra, NIA Jaipur, for organizing this event. Our organizing committee members, Dr. Aparna Sharma ma'am, Dr. Gulab Pavnani sir, Dr. Prabhakar Vardhan sir, and Dr. Rajendra Soni sir. Before starting the webinar, let us take blessings of Lord Dhanvantri. I would like to request Dr. Gulab Pavnani sir for Dhanvantri Vandan. Please, sir.
Namaskar to all.
Sir, please unmute yourself.
हाँ अनम्यूट है, आवाज आ रही है?
आ रही है सर।
हाँ सर, आ रही है।
राष्ट्रीय आयुर्वेद संस्थान मानद विश्वविद्यालय के शालक्य तंत्र द्वारा आयोजित आज की इस वेबिनार की
Gulab ji, may I interrupt? There is echo from your side. I think two mics are on at your end.
सर अभी तो एक ही ऑन है सर।
Okay, so now you're very clear.
सर
Yeah.
राष्ट्रीय आयुर्वेद संस्थान मानद विश्वविद्यालय के शालक्य तंत्र विभाग द्वारा आज के इस आयोजित वेबिनार का प्रारंभ हम हमारे आदिदेव भगवान धन्वंतरी की वंदना के साथ शुरू कर रहे हैं। तो आप सभी भी भगवान धन्वंतरी का ध्यान करते हुए वंदन करें। नमामि धन्वन्तरिमादिदेवम् सुरासुरैर्वन्दितपादपद्मम् लोके जरारुग्भयमृत्युनाशम् धातारमीशं विविधौषधीनाम्। जय जय हे धन्वन्तरि भगवन् तव चरणों प्रणमाम देव दनुज नर वंदित गदहर शरणं तव श्रयाम। जय जय हे धन्वन्तरि भगवन् मथित पयोनिधि मध्य समुद्भव पाणावमृतधारिन् सुख दो वर दो धन दो भवतात गद भयवारिन् कारिन् धीयतां हि लोकेभ्यः सुतराम् स्वास्थ्य चयः सुललाम। जय जय हे धन्वन्तरि भगवन् तव चरणों प्रणमाम। जय जय हे धन्वन्तरि भगवन् जय जय हे धन्वन्तरि भगवन् जय जय हे धन्वन्तरि भगवन्। जय धन।
Thank you, sir. Now I request Shamsha Fiaz ma'am, HOD of PG Department Shalakya Tantra, NIA Jaipur, for welcome and inaugural speech on today's webinar. Please, ma'am.
Thank you, Shravani. Respected Director Sir, Professor Sanjeev Kumar Sharma Sir, and our eminent speakers, Professor Shanta Kumari Madam from Trivandrum College, Kerala, and our Honorable B.A. Venkatesh Sir, HOD of Kalabhareshwara College, Kerala, and our other speakers for tomorrow's session, Dr. Rajesh Pawar Sir and Professor Sangeeta Salvi Madam, and all our staff members, Dr. Gulab and our other staff members, colleagues, and HODs of National Institute of Ayurveda, our students, PG and PhD scholars from National NIA, as well as all our viewers. A very good afternoon to all of you. Today, I'm extremely pleased to organize this national webinar, which is based on practical utility approach in Shalakya disorders. So, as the title itself suggests, that practical approach is very important in order to practice Shalakya disorders effectively. So that is why this is the theme of the seminar. And our guest speakers, Professor Shanta Kumari Madam and others, definitely will highlight us and provide advanced knowledge in order to practice Shalakya Tantra effectively. And also, I would like to extend my heartfelt thanks to our Ministry of Ayush and also our Honorable Secretary, as well as our Director, for providing us an excellent platform in order to represent our views and also to create such educational atmosphere not only in NIA but also all over India. And also, I know that our viewers are even abroad, like we have participants from Sri Lanka and one from America also. So it is a very excellent platform, and in future also we should use this platform. And this COVID-19 has actually changed the whole scenario, and in this way it has brought all the people of the world together. And definitely, as NIA has become a deemed to be university, it will provide more opportunities on this international background. And definitely our director, sir, who has brought flying colors to this institution and who is very dynamic and has a keen vision in this regard, will definitely take this institution to higher standards. And I would like to especially thank sir for in this regard. And as the topics of the seminar, we can say that all are very in need of the art in present scenario. And definitely our students and viewers will be engaged, and they will get sufficient knowledgeable fest, and they will enjoy the 2 days program. And thank you very much for participating in this program. And till now we have around 700 viewers and who have registered, and more are going to attend this seminar. And we will definitely, I can say that this webinar will be a success nationally as well as internationally. Thank you for all your participation. Thank you, one and all.
Thank you so much, ma'am. Now, I'm honored to invite our respected director, Professor Sanjeev Sharma sir, who is our chief guest of today's webinar, for his words of wisdom and also for blessings on this webinar. Please, sir.
Thank you. Shravani, am I audible?
Yes, sir.
Thank you very much. And very good afternoon to all of you from NIA. Respected Professor Shamsa Fiazji, all my fellow colleagues from the Shalakya Tantra Department faculty members, eminent experts and speakers, Professor Shanta Kumari ji, Professor B.A. Venkatesh ji, Dr. Rajesh Pawar, Professor Sangeeta Salvi ji, and all others who are present over here, my dear students. And as Shamsaji said that there are participants from abroad also. First of all, on behalf of NIA deemed to be university, I extend a warm welcome to all of you on this excellent platform of Shalakya Tantra. And I also extend my heartiest greetings and best wishes of Deepavali to all of you. And I also extend my best wishes for the new Vikrami Samvat. So first of all, my congratulations to the Shalakya department and organizer Shamsaji, Gulabji, and all other faculty members for organizing this seminar of 2 days, this webinar, in fact, that is the national webinar on practical approach in Shalakya disorder. This is an excellent idea to organize such kind of webinars, and because webinars are now new learning for us. Shamsaji rightly pointed out and said that COVID-19 has really redefined the life and has really redefined the world. And this kind of seminars or webinars are new learning for we people. And despite of all odds, through these webinars, we are connected with each other. We are connected emotionally. We are connected academically. So wonderful idea to organize such webinars, and we should keep these kind of conversations, communications, and learning platforms continuously. And NIA has taken the lead to organize the seminar. I really congratulate this department, and hopefully that this webinar will give nice output for the participants and good learning for we people, we all. Shalakya Tantra itself is a wonderful subject, and really requires a practical hands and excellence in the practicals and sensitive hands. So the importance of such seminars, although these are the virtual seminars, but really they will be knowledge sharing, and our eminent experts from different parts of the country, they will be sharing their knowledge, they will be sharing their experience with our participants, with our teachers, and that will definitely enlighten our faculty as well as our students. Friends, Shalakya Tantra is, as I said, that this is a wonderful subject, and including this ENT, eye, dentistry, and so many other issues are related to Shalakya Tantra, and it needs to be, this department really needs a big elaboration, and it needs further expansion. And here all the experts of Shalakya, they are present on this platform, so we can seriously think about that, how we can go further. This not only just in this platform should not only be just giving lectures, but at some point of time, within these 2 days, we can think of that how we can further improve our this department, so that the working of this department can further go and can fly like anything. I assure to my department of Shalakya Tantra that whatsoever the demand you will put before me, and so far as the infrastructure or equipments are concerned, I shall try to fulfill those. And even you can imagine high-end equipments, so that we can materialize those things, and for the teaching training of the students and for the welfare of our patients. We already are having very much well established Shalakya Tantra department, but I want that it should further improve, and our eminent experts who are there, they can well as guide us that how we can, and they can educate us that what kind of improvements we can do for this department, so that this department should be a department of excellence in the country. That is my dream. And I am proud that my faculty colleagues who are there in the department, they are expert of their subject, their specialty, and they are having very good reputation. And further, our speakers, they will guide us, and they will also tell us that how the faculty knowledge can be enhanced. So, and my appeal to the students who are here, are the teachers who are newly inducted teachers in different colleges, if they are there, then my request and my appeal to them, that kindly focus on the subject, and let us try to work hard to work for the attraction of the patient, for the welfare of the patient, so that this department can establish itself as a high impact department, because there are a lot of things like Kriya Kalpa and so many other things we can do, and we can attract the population. It is not the matter of attraction, but in fact it is a matter of benefit of the society, how we can benefit the society, how we can serve the society, serve the nation through this facility, through Ayurveda. Really, that will be a wonderful contribution for the humanity. Friends, I shall also urge the experts, or all the experts, that kindly guide us that how we can start our OPD work, or even indoor work during this COVID period, because we are very keen to start outdoor, and even if it is permissible, then outdoor. What precautions we should take, and how we can start slowly and slowly, because since long hospitals are closed, and OPDs of Shalakya, particularly Shalakya Tantra, are very much closed because of the fear of this COVID. So how we can now start? And my appeal to the department, that let us start the OPD work, and with all the precautions and the inputs from our experts, those will be very much valuable. And I want to see that this department should run now OPD work, and later on we can slowly and slowly increase our work. And I hope that this will be a very much successful webinar, and output and outcome of this seminar will be excellent. I wish all the best to the to the organizers for the success of this webinar, and my congratulations and my thanks for organizing this event. Thank you very much.
Thank you, sir, for your motivating speech. Really, we are enriched with your vision, and definitely we would like to make this center as a center of excellence of eye, ENT, and dentistry. So that is also our dream, and I'm very happy that you are going to support us in this regard with good infrastructure and other facilities as desired. Thank you very much, sir, for your presence also in this inauguration, sir. Thank you, sir.
Thank you, madam, and I will take your permission to leave. And again, my best wishes and my regards to all respected experts. Thank you.
Thank you, sir.
Thank you so much, sir, for your blessings and best wishes. I am sure that we all will be enriched with the knowledge after completion of this event. Now, I would like to share the program schedule of this webinar. Today, for the first session, our first guest speaker is respected Professor Shanta Kumari ma'am, retired Professor, Government Ayurved Hospital, Trivandrum, presently CEO of Mata Ayurvedic Hospital, Trivandrum, will share her experience on practical utility of Kriya Kalpas in Netrogas. Our next speaker will be Professor B.A. Venkatesh, the HOD, Kalabereshwara College, Bangalore, who will share his experience on practical approach in eye disorders. For tomorrow, that is on 20th November, the webinar starts with the session of respected Dr. Rajesh Pawar sir, founder and director at Nimi Eye Care Treatment and Research in Ayurveda, Netra, who will share his experience on various techniques in corneal grafting, followed by the session of Professor Sangeeta Salve ma'am, HOD, Department of Shalakya Tantra, Tilak Ayurved Mahavidyalaya, Pune, who will share her experience on surgical approach in ear disorders. Now, I hand over the dice to my colleague, Dr. Anita Vishnoi, to manage the program forward.
Thank you, Dr. Shravani. Myself, Dr. Anita Vishnoi, PG Scholar of Shalakya Tantra, National Institute of Ayurveda, Jaipur. Moving onwards, I would like to welcome Honorable Professor Dr. Shanta Kumari ma'am. I like to share brief introduction about ma'am. Dr. Shanta Kumari ma'am has completed PG in Netra Chikitsa from Government Ayurveda College in 1982 and worked in various Ayurveda colleges of Kerala as professor and was also an active member in various professional membership like State Executive, Ayurveda Hospital Management Association, former President Shalakya Specialist Association Kerala. Madam has presented more than 50 papers in various national and international seminars and also published numerous articles on the subject of Shalakya Tantra. Madam has published many books like Eye Diseases and Treatment, Ear, Nose, Throat Diseases and Treatment. Madam has been honored with many awards like Best Teacher Atreya Award, Legend Shalakya Award, and also a founder of first NABH accredited Ayurvedic Hospital of Trivandrum. Now, Madam is working as founder and chief physician at Mata Ayurvedic Eye Hospital. Today here ma'am is amongst us and going to enrich our knowledge with practical utility of Kriya Kalpa in Netra Rogas. I would like to welcome you ma'am. Over to you ma'am. Please proceed ma'am.
Thank you. Am I audible? Am I
Yes,
audible?
ma'am. Yes, ma'am.
Okay. Good afternoon, everybody. And, I am sharing my screen. Is visible?
Yes, ma'am.
Okay.
Yes, ma'am.
I am very happy to be here to share my experiences and my opinions. And I am really thankful to the organizing committee, especially my dear friend Shansa Fias, for inviting me for this webinar. And actually, my topic is Kriya Kalpas and its importance in Netra Chikitsa. And always this question comes in my mind, why Kriya Kalpas are that much important in the treatment of eye diseases? Usually whenever we think of a disease and its treatment, the first term that comes in our mind will be medicine, not the procedures. But whenever we come to the aspect of Netra Chikitsa, we will be thinking of Kriya Kalpas first. When I was working in the college, for about 30 years, I was in various colleges. The students always used to ask me, can this disease be treated with a tarpana, or can this disease can be treated with a sega, like that? They're not asking about the medicines. Always the procedures comes their mind first. What is the reason for that? Because in Ayurveda, the mode of preparation of a medicine and mode of application of a medicine, they're equally important as the selection of a medicine. That is, mode of preparation means Aushadha Kalpana and mode of application is Kriya Kalpa. And why Aushadha Kalpana? There are so many reasons for that. For example, I will tell you an example. Let us take a very, very familiar medicine, that is not medicine, when ingredients, Tribala. We know the properties of Tribala, we know the ingredients of Tribala, we know the gunas of Tribala, but how can we implement its efficacy? How can we use it in a particular disease, in a particular person? Is it possible to chew one by one, or is it possible to eat one by one? No. Then comes two questions. In which form this medicine should be applied, and in which form it should be prepared. Only when we get an answer for these two, we can use this Tribala. That means this Aushadha Kalpana and Kriya Kalpa comes into the scene. There are so many preparations, Tribala Chorna, Tribala Kwada, Tribala Lehe, Tribala Krita, Tribala Mashi. Like there's so many preparations are there. Which one should be used? Then comes the second question, how it should be used? Whether it is to be taken internally, or whether it is to be put externally, or whether to be used for massage, or to be used as a drops. Like there's so many mode of applications. So this Aushadha Kalpana has its own importance. The main use is to increase the medicinal efficacy, and this is very important, to nullify the side effects or unwanted effects, if any. There may be some unwanted effects, unwanted properties in that combination. In our science, always we are using combinations of many ingredients. So if there is an unwanted effect, it should be ruled out. For that, this Aushadha Kalpana will help us. Then to convert the ingredients into absorbable form, that also is very important. Then that medicine should be most suitable for that particular area or that particular ashrayasthana. The same disease may develop any part of the body. If you are coming to the eye, some particular part, maybe in the cornea, maybe in the sclera. So that medicine should be suitable to be used that particular area. So then comes to make the medicine suitable that particular Kriya Kalpa. That is our importance now. How to apply that medicine. For that purpose, this medicine should be suitable. If we have to say, apply the medicine in the form of Sega, what preparation should be there? If you are using that medicine in the form of drops, how it should be prepared? So that is importance of Aushadha Kalpana. Then the important question again comes, why these different forms of procedures, Kriya Kalpa? What is it? The Kriya Kalpas are nothing but highly modified and highly specific methods for application of a medicine for a particular area or a particular structure. So that particular procedure can be done in a particular site only or a particular area only. That means if you are doing Abhyanga, that can be done on the external surface, or if you are doing Sega, that can be done on that particular site or an area only. So that is why it is a modified and specific methods for application of a medicine in a particular area. That is importance of. Then why this particular area is important? The anatomical configuration of a structure is highly different from one part to another in a human body. That means, for example, what can I say? Take muscle. We can take two muscle in our body. Let it be one eye muscle, iris muscle or extraocular or endocular muscles. Then take calf muscle. Both are muscles. But can we apply a medicine the same way on both these muscles? Never. So we have to consider the characteristic features of that particular muscle before we selecting a mode of application. So in the case of eye, these anatomical variations are highly significant. If we take cornea, it is 100% avascular and transparent. But the nearest structure, that is sclera, that is 100% opaque and highly vascular. So the mode of application which we select for the disease of sclera cannot be suitable for a disease of cornea. That is the difference. See, when we go to the anatomy of the eye, it is described on the basis of these Panchabhutas. In Susra Samhita, we can see that. Palam bhuo, agnido rektam, vadat krishnam, sidam jalat, agashad akshru margascha. That is the description given. That means these anatomical features are described from the very basis, not on dhadus, not on doshas, but on the basis of Panchabhutas. So these variations of the presence of these Panchabhutas gives its own characteristic nature to that particular structure. On that basis, we have to select a particular mode of application also. So now let us come to the point one by one. If we are considering a disease of conjunctiva, we have to know the predominant Bhuta is Agni. And the so itself, its dosha will be Pitta. Because Agni do rektam, where there is vascularity, that area will be Agni predominant. So itself, dosha will be Pitta, Dhadu will be Rikta. So itself, the main pathological conditions will be inflammations, since there is Pitta and Rekta in dominance. The pathology of inflammation will be very easy in a conjunctival, in the structure of conjunctiva. Then eyelid, it is muscular. So palam vo, so there is the predominance of Prithvi Bhuta, and since it is vascular, there will be predominance of Agni also. So we have to consider Kapha and Pitta while we consider disease of eyelids. So Dhadus will be Rasa, Rekta and Mamsa. So itself, inflammations, different types of growths and different types of pedagas and cysts are very easy to develop on eyelids. When sclera, it is very clear that Jala and Prithvi are the Panchabodas. So Kapha will be the dosha, Mamsa is the dhadu, and growth and nodules are very common. Cornea, we have to consider Vata and Jala. It is transparent and very soft and very flexible. So Kapha can be considered as a dosha, and dhadu can be considered as rasa, and opacity is the main pathological change. These are only common. There are exceptions. There are corneal ulcers and there are corneal vascular. But I am considering the common situations, common conditions only. And what I am saying here is mostly from my experience also. Then retina, coming to retina, we have to consider seriously Vayu and Agni as the predominant bhutas. Then Vata and Pitta as doshas, and almost all the dhadus and different types of inflammations and degenerative conditions can be considered as the pathological changes. Okay, so this is the importance of the anatomical or structural characteristic features. While considering the intraocular fluids, no doubt it is Jala predominant and Kapha predominant and Rasa is the main dhadu, and blockages and opacities are very common. Lacrimal passages, Agash Buddha, Vada and Asti and obstructions are there. Now, while considering a disease of these parts, we have to consider these anatomical features. On the basis of that only, we can select a particular mode of application of a particular medicine. What is the aim of an application of medicine? There should be optimal level of absorption of that medicine and maximum efficacy of medicine, and thereby we have to get maximum results. Again, we have to minimize the side effects and probable complications. So we have to satisfy all these factors before selecting the mode of application. That is very important because we are handling the most precious organ of the body and most precious gift of the creation or creator. So we can easily say that the one method of application cannot be used in the same way in another part of the eye, because you can see one is transparent, one is opaque, one is vascular, one is avascular, like that it goes. So there are so many conditions and risk factors to select a particular mode of application. But by the grace of Ayurveda, fulfilling all these conditions and all the risk factors, there are certain procedures for application of medicine in the treatment of eye disease. These are known as Netra Kriya Kalpas. In short, we can say this Netra Kriya Kalpa means this modified, specific mode of applications to get the maximum result of that medicine and to make out and to rule out all the complications which may happen during the phase of treatment. So, while we consider the Kriya Kalpas, we have to consider the methods, that mode of application inside the eye, and the methods to be selected, which is to be applied external to the eye. And some procedures should be used both internal and external. Now come to our mainstream. What are the Kriya Kalpas we have to select for an application of medicine inside the eye? These are mainly, everybody knows, Aschodanam, Seka, then Anjana, and then Tarpan, then Padapa. And two procedures there to be applied external to the eye is Pindi and Vidalaga. Pindi and Vidalaga. And both inside and outside we can use Pradisaranam and Lebanam. Then we can discuss about the very specific medications for inside the eye. Then we have already discussed the anatomical importance, anatomical characteristic features of each organ, each particular area of the eye. So, when we come to these treatment procedures, we consider Aschodana and then Sega, then like that one by one we can take. Here, dear friends, I am not trying to describe what is Aschodana, what is Sega. Everybody knows it. I want to bring it to the practical aspect, because I think sometimes all the eye diseases can be described under the head of these procedures. That means, what are the diseases that can be treated by Aschodana? Like that, we can classify the disease under these 5 heads. That much importance is there for these procedures. So, in short, generally we can say that Aschodan and Sega are highly effective and most preferable in Pitta dominant eye conditions, eye diseases. And Anjana is more effective in Kapha predominant conditions. Tarpana and Padavaga are highly effective in Vata predominant eye diseases. And Pindi and Vidalaga are very effective in Pitta and Kapha dominant diseases. From this, we can select the area where we can use this Aschodana and Sega Anjana like that. We have already seen which are the areas where there is Pitta predominance in the eye. If there is a disease in that particular area, we can use Aschodana and Sega as the mode of application. For example, I will say for this eyelid and conjunctiva, these are Pitta dominance. We have already seen that. And for the disease of conjunctiva, this Aschodana and Sega will be more effective. And sclera and this eyelid, there is Kapha dominant. For the disease of Kapha dominant of eyelids, we can use Anjana as the first line of treatment. And in the retina and this iris and other structures, there is dominance of Vata. So for the disease of that, Vata and Pitta are there. For the disease of that structures, we can use Tarpan, Pudavaga, etc. as an important procedure. These are in common sense only, and there are exceptions for any disease, for any condition. If you're interested and if the time, we can discuss about it. But for this should be our base, then only we can go for the further steps. So how can we understand that this is a Vata dominant disease or a Vata dominant structure like that? Different types of, let us come to the Vata dominance. Pain of different types, numbness, restrictions in movement, etc. If we see in a eye disease, and we see the visual symptoms like scotomas, field defects, color blindness, and the shape difference, metamorphopsia, micropsia, macropsia, and loss of vision, we can say that there is Vata dominance. Then we have to select the eye treatment procedure which is suitable for Vata predominance. We need not go to the particular name of the disease. That is not an important factor. We can identify the dominance of dosha and identify this area where it is the Asraya Sthana, Accordingly, we can select a Kriya Kalpa. That is what I want to emphasize. Then, objectively, what I told before is subjective level. This is objective level. Any type of muscular dystrophy, any type of paralysis, any type of restricted movements, or in retina if you see shrinkage of vessels, or detachments and atrophies, these are all objective signs of Vata predominant diseases. And when we come to the Pitta predominance, pain, photophobia, burning sensation, and blurring, these are very typical symptoms of Pitta predominant diseases. And visually, the patients will be complaining of flashes of light and the difficulty to face bright light, day blindness, different types of this metamorphosia and color blindness. And if there is a sudden loss of vision, it's maybe due to hemorrhage or due to some vascular obstruction and followed by hemorrhage. These are all symptoms of Pitta predominance. So, if you have a retinal hemorrhage, or if you have a these leakages of fluid, and there is flashes of light, whenever we see these symptoms in a patient, before going to a particular diagnosis, we can understand that there is Pitta predominance. Here, I want to convey you one thing. We have to we have to depend on the symptoms and signs more, because most often patients come to Ayurveda after doing something, some steps as a treatment. Sometimes they have already gone for laser treatment. Sometimes they should have already tried some intraocular injections or some eye drops like that. So we cannot identify the actual pathological condition of that previous disease. So we can diagnose that case on the basis of that particular situation, that particular stage, when the patient comes to our treatment. Then we can select the medicine and a Kriya Kalpa accordingly. I hope you follow what I mean. Then what are the Pitta dominant signs? Generally, everybody knows redness, watering, congestion, edema, hemorrhages. These are all Pitta dominant signs. So these signs can be seen in many diseases. That is important. That is what I want to convey to you. The same symptoms can be seen in different diseases, and in the same symptoms can be seen in different stages of different diseases. So, irrespective of the name of the disease, we can select a Kriya Kalpa on the basis of that present condition. Even though the name of the disease space is same, the stage differ. Then we have to change the Kriya Kalpa also. For example, see when we start Anjana, while describing Anjana, it is said, after subsiding the inflammation, after subsiding Raga, Shobha, etc., then we have to change, we have to shift the Kriya Kalpa from Sega to Anjana. The disease is same. So we have to depend more on the subjective and objective level of signs and symptoms. Then if you come to the Kaba, anything, any symptoms like heaviness, fullness, itching, etc. are due to Kaba. And visual symptom will be mainly gradual loss of vision, opacities or cataracts. These are all, or maybe this corneal opacity or lens opacity, or even night blindness. That is very important. Always night blindness is misunderstood by students. Since there is loss of decrease in vision, they'll be immediately thinking that it is due to Vata, or they'll be doing Darpana. No. If it is pure night blindness, it is due to Kaba, Doshanda, or even in the different stages of Nagalanda, we get a pure night blindness. In that stage, Kaba will be the dominant factor, and we have to select a treatment procedure, a Kriya Kalpa, which is suitable for Kaba, that is Sanjana. There are so many types of different types of Anjana preparations for cataracts and for corneal opacities and for night blindness. If you go through the text, we can see that. So don't make a mistake. If there is night blindness, don't go immediately for Tarpana and the Vata dominant Brahmana Chilisas. And investigations or tests should be done to get a clear diagnosis and to confirm whether there is predominance of Kaba in that patient. And select the Kriya Kalpa accordingly only. What are the signs? All opacities are Kaba dominant. All growths are Kaba dominant. Exudates are Kaba dominant. So, what are the retinal changes? Any type of retinal exudates, neoplasms, and other growths, and fluid accumulations. That means in diabetic retinopathy also, after some hemorrhage, there will be clots, or in macular degeneration, there will be exudates, and in macular edema, there will be fluid accumulation. All these conditions, we have to consider Kaba as a main factor. So we have to select a Kriya Kalpa which is suitable for Kaba predominance. So while we select some drugs or some medicine for Vata Shamana, it should satisfy some factors, some properties. It should be suitable for CNS. It should be suitable for also Buddhiman, etc. Because Vada has its seat in the Pranavada is in the head, and the Buddhi, the Man, etc. also is there, and so we have to consider that factors also. And should have Anilomana property and generally Rasayana in Guna. Then comes the most important thing, should not vitiate Pitta. It never vitiate Pitta. When we consider a treatment or a procedure for Vada predominance, we have to consider Pitta also. Because Pitta is the actual active factor in the eye. That is all the properties, all the functions of the eye, that is of vision, is due to Alojaka Pitta. So any treatment we select for the eye should not vitiate Pitta. It should protect Pitta, especially when we consider Vada. Because Vada is acting, not acting, but activating Pitta in its function. So it should be Pitta, Vada Shamana should be Pitta Shamana also. For example, Jivandi, Vidari, Shadahua, Devadara, these are all. And when we come to a medium of medicine, that should be Ghridam, not Thailam. We know the Agrevashada for Vada is Thailam, but when we come to eye disease, it's better to select a Ghridam for Vada disease, because Ghridam is suitable for Vada and Pitta. So keep it in mind. When we selected the medium for a medicine or an application for Vada predominant disease, it should be Ghrida, not Thaila. If you select a Pitta Shamana Drivya, it should be Rakta Pitta Shamana, and the same point comes here also. It should not vitiate Vada, especially Pranavayu. I mean, we have to consider Shida Virya there. If that Shida Virya of that particular Chakshushi Drivya for Pitta Shamana is possible, it may sometimes vitiate Vada. If so, keep it away. We can select something else. Here also the medium is Gridam, the best one. Okay. So Amla, Draksha, Lodra, Madhuga, Darvi, Chandana, these are some examples only. For Kaba, that also should have Rasayana Guna, should not change the ophthalmic tissues on external application. It never damage. because many of the Kapashamana Drivyas has some Vada vitiating property. So we have to avoid that. It should not be excessive, more or too much Tirshana in its property. See, Vibhidagi, Marija, Gaidika, Madhu, Vibhidagi, many of these ingredients or many of the Drivyas, when we see as an medicine for Kapha predominant disease, we can see that these are Rasayana also. Because it should not vitiate Vada, that is one thing. So it should be very, very careful while selecting a Kapha medicine for a Kapha predominant disease in the eye. Because we have to keep the Tejnada of Pitta. When we are describing this anatomy of the eye, we can see Chakshus Tejomayam Tasya Visheshal /Mado Bhayam. Eye is Tejomayam. So we have to keep the Tejomayatum as such to get its full function, full properties. So never damage that Tishnada. That is why when we select that means we have to keep the Tejomayatum of the eye intact. Okay. Now we can generally say Ashodhana, etc. One by one I will describe. When we can, then now only the thing we have to study it is when we can use Ashodhana. We have already seen that where we can use Ashodhana, and now we have to study when we can use Ashodhana. The indication is initial stage of eye diseases. It doesn't mean that take Ashodhana as the first step of treatment when the patient comes to us. It is not like that. It should be the initial stage of the disease, not the initial treatment by an Ayurveda doctor. And the predominant dosha should be Pitta in general. There are exceptions in Vada dominant also we use Ashodhana as Pitta drops, but in general we can say Pitta because Pitta is the sthanic dosha inside the eye. So without disturbing Pitta, Vada and Kapha cannot develop a disease in the eye. So we have to consider Pitta as the initial vitiated dosha. So what are the symptoms we have to consider? If there is redness, congestion of vessels, and watering, etc. That is the indications for the Kriya Kalpa of Ashodhana. And what are the symptoms? Mild pain and foreign body sensation and itching. If we see these symptoms in a patient, in an eye disease, irrespective of the name of the disease, we can select Ashodhana as the Kriya Kalpa. Need not go to the diagnosis first. That is necessary, that is important. But while we select the Kriya Kalpa, we have to consider so many other factors rather than the diagnosis. Because if we are going to the diagnosis of an allopathic term, it will not satisfy our needs. That is why I am again and again emphasizing these indications. So the indications for Ashodhana should be initial stage of the disease, some dominance of Pitta and these particular signs and symptoms, etc. So for this which Kalpana we have to select fluid, it should be fluid in nature. So Kashaya, Sarasa, nowadays we know everybody has started to use Arkam also. And even I think with the single drugs can be used as Arka form. I think there also in Jaipur also Shansang has already started making Arkas and using in many eye diseases. If not started, we can start. It will not give any irritation or any pain or anything like that. So it can be widely used. And rarely Ghridam also we are using for Ashodhana in special conditions. Then for Sega, here severe pitta predominance will be there. And the symptoms, photophobia, burning sensation, and foreign body sensation, etc. The signs everybody knows: redness, watering, and congestion of vessels, edema, discharges, etc. We can select Sega as the first choice of Kriyakalpa. And mainly in the pathological conditions of inflammations and infections, Sega can be used. And the duration better 2 to 3 minutes only. The Aushadha Kalpa in the same way, which is used for Ashodhana. These are some in liquid forms. So, we can summarize Sega as if there is predominance of Pitta, and if there is very particular signs and symptoms of Pitta dominance, and if the pathological changes are inflammations and infections, we can select Sega as the first preference of Kriyakalpa. There also I am trying to avoid that particular diagnostic term. Because if there is watering and if there is redness, if there is discharges, we can't do Tarpana, we can't do Padavaga, we cannot do Ranjana also. So we can depend on the signs and symptoms on the basis of dosha dominance. So for beginners and for practitioners, this is very, very important. If not,
Hello, what happened, madam? Is it disconnected? Hello? Madam? Hello, madam, disconnected now. You can start now. Okay, no problem. Okay. So there's some problem, madam will restart it. Okay, we'll just continue.
okay.
Yeah, continue, madam.
Am I audible?
Yes, you are. Yeah, audible, madam.
Okay. Sorry for the disturbance. Can you see the screen now? Screen is visible? Hello?
No, ma'am,
Screen is not visible, ma'am.
Not visible.
Not
Okay,
visible.
I'll make it. Now is it visible?
Yes, ma'am, visible.
Now it is visible now? Hello?
Yes, ma'am.
Okay. Sorry for the disturbance. Okay. Now we are speaking about Sega. Now, if we are seeing all these signs and symptoms of Pitta predominance in an eye disease, irrespective of the particular diagnostic term, we can select Sega as the first line of Kriya Kalpa. That is what I want to convey. It's okay?
And proceed.
Then coming to Tarpana, we have to confirm that Vada is the predominant condition, dosha, and different types of signs and symptoms of Vada predominance is there. For example, shrinking, different types of palsies, atrophies, and symptoms like pain, eye strain, visual defects, and a decrease in vision, etc. We can select Tarpana. And the pathological changes will be mainly different types of degenerations and atrophies. And even detachment, we can
Ma'am, not audible.
for about 15 to 30 minutes are most convenient time in my opinion. And the Aushadha Kalpana, no doubt, Grida Kalpana. Rarely you can use Arkas and also Kashayas, but the condition will be very specific and the diagnosis also should be very perfect. The Anjanam, this is the, I think Anjanam is the gift of Shalakya for the eye disease. And we will generally think Tarpana is the most important one, but it is not like that. If we select, if we go through the text, we can see many hundreds of Anjana combinations, Anjana preparations we can see. But for Tarpana, we will see very few preparations because most of the diseases are dosha Kapha predominant. Different types of opacities, nodules, and accumulations, and symptoms like heaviness, itching, pain, etc. We can use Anjana. And we can select Anjanam as the Kriya Kalpa. And the Aushadha Kalpana is either Churna, Varti, or Rasakriya. Time of application, in my opinion, is better in the morning than in the evening. And another important point is that Anjana can be used. This particular Kalpana can be used as a preventive measure also, because it cleans the Srodhas. Anjana has a Shodhana property. It has a Kapha Shodhana Guna. And so itself it will maintain the circulation. And so it will stimulate the nerve endings and with not vitiate, sorry, that word, it will remove the accumulation of vitiated Kapha. So the first, previously I told Chatusthejamayam Tasya Vishesha Shleshmado Bhayam. So Kapha is the enemy of the eye, actually. Whenever Kapha gets accumulated, Kapha gets vitiated, disease will develop. So it is our responsibility to eliminate unwanted Kapha always. That is why Anjana is prescribed as a Kriya Kalpam or a procedure to be used as a routine practice. In Dinajari it is prescribed. Savyeram Anjanam Nityam Yojayet. Saptaratara Jasanjanam. So it will keep our eyes healthy. It will try to eliminate the unwanted accumulation of Kabas, vitiated Kabas from our eye. And in that way, it will keep the dominance of Pitta and it will keep our Alojaka Pitta intact. So our vision will be protected. That is why Anjana is prescribed in the Dinacharya. Pindian Vidalaga, it is important, but compared to other things, this is not that much important. Because this is used only on the external parts. Mainly in Pitta dominant and Pitta and Kapha dominance. If there is swelling, pain, redness, etc., Pindi and Vidalaga is very effective. And time of application, it varies according to clinical condition. Usually I used to apply up to 45 minutes to 1 hour. Aushadha Kalpana, Kalkam. So in different types of, even in macular edema, I used to apply this Vidalagam. It gives very good results. And even in diabetic retinopathy, I used to apply this Vidalagam. That is giving high results. Risarnam and Labanam, it can be used mainly in Kapha dominant conditions. And Labanam in all dosha dominants. And it is very rare. The indications are very rare. And all the condition, other things are according to general rule. Okay, now I think I have described some factors. It is not completed. It is not able to complete within 1 hour. So I want to give an advice to my juniors and my colleagues and also to my students that never depend on a particular term of diagnosis to start the treatment. We can depend on our own theory, that is dosha predominance, site of aversion, that is Sasrasthana, and the signs and symptoms, so that we can start the treatment by selecting a condition, medicine. And this is a condition I just want to show you. This was the situation of a patient when came to me. What diagnosis we can give? In the inner canthus, and the medial canthus was highly inflamed and just like masses like that was there. And this boy has already done 5 surgeries in his eyes. But after some days it will again come. And the treatment I did in this condition was only Pradisarana and Jalavgamajarana and then Labana. And what happened? Can you see a sharp thing coming out of his eye? And while applying this after applying this Jalavgamajaranam and doing Pradisarana, this sharp thing came out of his eyes. It was a small piece of bamboo. Even after 5 surgeries, it didn't come out. But after this treatment came out, I didn't diagnose the case. I was not able to diagnose, but I got the results. After 7 days, this was his eyes. So, need not worry to find out a diagnosis. We can diagnose it clearly. This is a condition with the pitta dominance on the Vatma Mandalam and giving such and such symptoms. Like that, we can diagnose. That is a perfect diagnosis. Then accordingly, we can start the treatment. We can select a medicine which is suitable for pitta dominant. And we can select a Aushadha Kalpana, which is suitable for pitta dominance, maybe Saga and Ashodhana. And that can be used as a Aushadha Kalpana, just like Ashodhanam or Saga. This should be your first line of thought. Then no doubt, there will be success. I mean, confirm the sthanic dosha first, then find out the vitiated dosha, then find out the ashraya sthana of the disease, select a drug of choice, then a suitable Aushadha Kalpana, then final, set the mode of application. That will bring you success. Okay? Then if you have any queries, this time is over. If you have any queries, I am ready to answer from my experience.
Thank you so much, ma'am. If anybody
Thank you very much, ma'am, for your invigorating speech, madam. So I think you have given us a new insight and you have evoked our thought processes so that we can think in this regard. And definitely, as you have shown a very successful case, if we if we start diagnosing which disease it is, then we will hesitate to treat the patient. But once we use the Ayurvedic principles and start the treatment, definitely we will get a result. So we are very much motivated and we are very happy that you have shared your experiences in this regard. So I think we can take 1 or 2 questions if we have. Otherwise, we can proceed to the next speech by Professor Venkatesh sir. Thank you very much, madam, for sparing your valuable time.
From Dr. Darshana. Question is whether squint eye is treated by any Kriya Kalpas other than eye exercise?
we have to get a differential diagnosis about skins. If it is due to some paralysis of these muscles, Tarpana can be used. And if there is any visual disturbance, one eye is okay and other eye is some visual problem, then also Tarpana will give good results. And side by side, we can start eye exercise. And I have also tried this Shiro Abhyangam and Shiro Dhara, etc. along with this Tarpana and along with the internal medicines and I exercise, I have got good results. More result will be in the children than in adults.
Thank you, ma'am. The next question is from Dr. Saurabh Bandyopadhyay. Ma'am, question is, what should be the treatment for retinitis pigmentosa in Ayurveda by Kriyakalp?
We know the RP is a genetic disease and the complete cure is out of question. Okay. And again, in my experience, the first, there are three symptoms are mainly there. One is eye blindness, then field defects and color blindness. And actually these three symptoms represent three doshas. Eye blindness is always Kapha dominant and color blindness is mainly Pitta dominant and field defect is by Vata. So it becomes Sanipadika. And the stage, in different stages, we get different dosha dominance. So in Samsarga Sannipadaya, Yada doshodayam kurya, that is the principle. That means when the patient comes to treatment, just analyze and find out which dosha is dominant at that stage. It may not be altogether in a equal status. Maybe sometimes Kapha is the dominant. Most often in the early stage, Kapha, I have seen Kapha in more dominant. And later stage, it will be Sanipadika and Kapha should, this Vada should be considered seriously. So I used to start with the Shodhana Chilsa first. And some Vajadi Kashayam and Patyakshadatredi and Shirovirajana Ganam can be used in my experience for Nasya, etc. And that in that way, generally some Kapha and purified, that type of treatment should be done first. Then only we can go for Rasayana Chikitsa. And Rasayana Chikitsa also should be selected according to the predominant dosha of that time. If it is these flashes of light and juvenile-like experiences and this color blindness, if these are more dominant, more serious in that patient, we can select some Pitta Shamana and Rasayana and Chatusha medicines. Draksha Chandanadi and Draksha Jigradam and this that type of Jivaniya Ganam, these are very, very effective at that stage. If in the later stage, all the doshas are there and Vada is more dominant, Jivandyadikritam or Bhadradarvyadi, this etc. And this type of medicine also can be used. So anyway, on the basis of RP, the same medicine continuously throughout the life, the same medicine will not give the desired results. Diagnose it according to the condition and select the medicine. This is my experience and my advice. Okay.
Thank you so much, ma'am, for sparing your valuable time. Moving onwards with our next speaker, I would like to welcome respected Professor B.A. Venkatesh sir. I would like to share a brief intro of respected Venkatesh sir. Sir has completed BSAM in 1980 and completed BMS in 1980 and completed PG in Shalakya Tantra in the year 1987. Sir has guided more than 40 postgraduate scholars in Shalakya and Salya Tantra. Sir has worked as a professor in various Ayurveda colleges. Sir has conducted various national seminars, workshops, and state-level campaigns on several occasions. Sir has presented many papers and also first in Karnataka to introduce Netra Kriya Kalpas in Government Ayurvedic Medical College, Mysore and Bangalore. Also served in National Service Scheme as Program Officer for 12 years at Government Ayurvedic Medical College, Mysore, and conducted more than 150 rural camps. Sir has also worked as Dean Ayush Faculty, Bangalore 2012 and 13. Moving onwards, Sir is amongst us and going to enrich our knowledge with practical approach in eye disorders. I would like to welcome you, sir. Over to you, sir. Please proceed, sir.
Thank you. Thank you, ma'am. Am I audible? No. Can you hear me?
Yes, sir.
Am I audible?
Yes, sir, you're audible. You can
Okay.
start your presentation.
Good evening. At the outset, I thank the organizers, the director of NIA, Dr. Shamsha Fayaz, professor and head of the department Shalakya Tantra, and then Shalakya faculty members, PGs, distinguished speakers, colleagues, and my dear PG scholars. It gives me an immense pleasure to share my views regarding the management of some of the eye problems with very simple medicines which we have been practicing. And at the same time, I take this opportunity to thank all the viewers and participants of this webinar. Now, to begin with, we all know that in the existing scenario, we see the ophthalmic practice that we are generally coming across, or in our OPDs or in our clinics, we see that eye diseases are steadily increasing. Say more than 253 million people have
Excuse me,
some
sir.
or
Sir,
the other
it is
visual
not visible.
impairment. 36 million are blind and 270 millions have moderate to some visual impairment. 4 out of 10 students in a class will have some or the other ocular problems. So often we come across with many cases of refractive errors. Probably the reason being, you all know that excessive usage of mobiles or electronic gadgets, tabs, etc., and continuously indulging in the usage of these electronic gadgets for more than 4 to 6 hours happens to be one of the most important cause for the steadily increasing eye disorders. Now, under the situation, we can express that good number of causative factors contribute for this steady increase in eye diseases. However, we can categorize them. We can categorize them under 4 different headings. Say, for example, we can categorize them as pertaining to nutritional anomalies. Secondly, we classify them pertaining to environmental hazards or environmental impact. Thirdly, the infectious
Sir, sorry to disturb you, sir.
conditions.
Do you have a slide share also? Do you have slides also?
No slides, I don't.
Okay. No. Continue,
Slides
sir.
are very clear. I tried. So third is the infectious disorders, that is various type of infections that we are coming right now. And then the fourth being the endogenous causative factors, that is nutritional. As you all know that today's nutrition or today's style of consuming food has deviated in many extents from our routine or from our regular intake of food. So this causes due imbalance in the digestion, in the assimilation, and then in the process of the Dhatuvardhana. So maintenance of good nutrition is essential for the comprehensive management and prevention of diseases. So this is very important. Now, many debilitating complications can be prevented or modified by attention to nutritional status and prevention of nutritional deficiency. See, in nutritional perspective, the mechanism that controls appetite and eating behaviors are directed to maintain energy intake that is adequate for the need of healthy adult, and at the same time more energy is required for growing children. So there should be an adequate balance between the energy, that is the foodstuffs for energy we are consuming, and the output. That means the equal energy should be spread. On the contrary, if the usual remarkable stability of the body weight and body composition requires energy intake and expenditure in a balanced manner. So energy balance is the simplest term. That means energy intake that maintains steady body weight, and energy insufficient is reflected in weight loss. That means it leads to karsha. However, energy abundance always gives rise to staulya. It gives rise to staulya. Then conditions that substantially modify the requirement, that is the nutritional requirement, include the trauma, infections, and the alcohol abuse, and also malabsorption. Malabsorption plays a very important role. We see that we are of the opinion that we are consuming a balanced diet, we are consuming rich, nutritious diet, but still we are susceptible to many problems. That is because of malabsorption. Malabsorption is one of the most important causative factor that has been highlighted in our samhitas as ama. Ama is one of the most important causative factor. So that is why it is elicited that the proper intake of food that is congenial to an individual, that can be easily digestible, and there is good absorption. So unless there is good absorption or proper rasakriya, formation of rasa, the dhatus will not have their original nutrition, as a result of which it affects the entire body. Now the practice of intake of the junk foods, abnormal quantity, that is there may be a less quantity or more quantity of consumption of food, and while consuming this food, many a time we prefer or we switch on to the rice items and the wheat. These two forms the principal food components. Then we also find that many a times there is deficiency. The food that we consume is associated with many deficient factors, like deficiency of vitamins, deficiency of minerals, deficiency of trace elements, which are very essential for the nutritional integrity of our retina and the nutritional integrity of our innermost parts of the eye. So, day sleep, excessive consumption of alcohol, and lack of adequate exercises, and sedentary habits contribute a lot for malabsorption. Even though we consume food readily 3 times or 4 times a day, but the absorption is not proper because of these habits. So deficiencies include, we all know that direct deficiency of vitamins connected with the eye include vitamin A, vitamin C, vitamin E. These three are very important, and to some extent, the vitamin B1. So the vitamin A, we all know, that is the beta carotenoids are very essential from the part of functional integrity of the retina, that is the pigmental layers of the retina. And at the same time, the integrity of the conjunctiva, the integrity of the cornea, basically depends upon the normal and adequate supply of this vitamin A. When we come on to B1, B1, as you all know, it is very essential for the continuity of the neuron. So many a times we see the nerve sheath undergoes damage, undergoes inflammation, undergoes degeneration. Varieties of injuries are seen to this nerve sheath. Whenever there is injury to the nerve sheath, because it acts as insulation, the impulses flowing through this lose their integrity when there is damage to this insulation. So this insulation is possibly corrected by this thiamine. Thiamine and B6 are the two important vitamins which keep up the normal insulative mechanism, which keep up the normal insulation of the nerve fiber or nerve sheath, because of which the impulses steadily flow and then the normal visual activities are restored. There are many conditions wherein we see that these impulses are blocked because of inflammation. We all see in diabetic these conditions, or in diabetes mellitus, there is palsy, sixth nerve palsy. Many times we come across with sixth nerve palsy, because of which the lateral rectus is affected. As a result of which there is diplopia. The individual develops diplopia. So it is because of the inflammation of this sixth cranial nerve. Also, we come across with such type of inflammations in our seventh cranial nerve, then in third cranial nerve. Many a times we see these inflammatory changes in the third cranial nerve also. When we see most of the external ocular muscles are involved, wherein the eyeball movement becomes stopped. The eyeball movement is completely restricted, as a result of which again you develop diplopia and again you develop so many visual problems. So if it affects other nerves, for instance, if it affects the auditory nerve or if it affects the lateral arteries, then you see immediately weakness. So this vitamin B1 and B6 together provide extensive help in regeneration of this nerve sheath or in restoration of this nerve sheath. Thereby, the impulses are restored, and more often the eye movements and other these muscular movements connected with the nerves become normal. So we have then vitamin C, ascorbic acid. You know that vitamin C is very essential and very important, having variegated functions. Many of them have not been fully established. Only few of its effect or few of its functions have been established. Out of which the most important being the collagen formation. Collagen formation is of most importance because we see capillaries are distributed everywhere in the body, isn't it? Similarly, we have the capillary distribution and we have microcirculation in our retina also. This microcirculation is affected due to many causative factors, of which the diabetes mellitus is one of the most important causative factor. So because of diabetes mellitus, we see the affliction of microcirculation of the retina. So here, the actual mechanism is that whenever there is any obstruction or whenever there is blockage, maybe due to atherosclerosis, maybe due to clot, or maybe due to other causative factors, in these conditions, we see the capillaries start developing just to provide the adequate circulation. There is capillary neocapillary genesis or angiogenesis. So when the capillaries form, then the collagen capillaries, is formed of single endogenous layer, single layer of endothelial cells. So for this endothelial cells, a brickwork is important. That brickwork is contributed by the ascorbic acid. If this endothelial layer are not strong, or if it is the wall is not appropriate, then there is leakage, micro leakage. So this leakage in due course of time give rise to macular edema or cystoid macular edema or blots and dart hemorrhages, and all such complications will be come across. If the vitamin C is normal, then automatically we see that these lining or these collagens develop and a healthy angiogenesis is achieved, and thereby further leakage or further hemorrhage is under control. Probably we have recently come across that vitamin C is given in excess in COVID infestations. That's only because in COVID infestations we see in the pulmonary tissue there is extensive leakages, extensive hemorrhages. So this once again because of failure of the collagen. So when you provide the individual with adequate amount of vitamin C, rich vitamin C, then automatically this problem is corrected. So more often the pathological complications of out of COVID is many a times brought under control, and the individual regains immunity, and the condition comes under control within few days. So vitamin C has got a major role. Apart from this, vitamin C is very important as a best antioxidant. We know that oxidants segregated or oxidants distributed around our vital areas in the retina are the prime causative factors for an issue of degenerative changes or inflammatory changes, and such other the inactivities or such others injuries to the leg. With ascorbic acid or vitamin C has the ability to promote the tocopherol, that is vitamin E. Vitamin E is the best known antioxidant. So for the functioning of the vitamin E, ascorbic acid adequate concentration is very important. So in presence of this, we see that there is a very good uh, collagen formation and at the same time effective antioxidant effects. As and when the oxidants try to collect over the vital regions of the eye, they are being removed. They are being removed, and that is what is assigned as antioxidant effect. So the best antioxidant effect of vitamin C and vitamin A play a very vital role in the integrity of the inner parts of the eye, that is retina. Then malabsorption, as said earlier, is one of the most important causative factor. So food when we consume, for example, we consume rice. When we consume rice, it is very easily much of the glucose is released into the blood. The concentration of the glucose entering into the circulation steadily, continuously gives rise to increased amount of glucose in the circulating blood. So this is not actually required. So we need what has to be followed or in food or nutrition, what is needed is the digestion should be complete, and then release of these glucose and release of other essentials should be slow and steady. If it is slow and steady, much of the complications resulted out of diabetes mellitus, much of the complications resulted out of sprue or the malabsorption syndromes usually can be overcome. So whatever we consume, it should have three basic properties. One, it should get digested easily. Then it should release the contents, that is whatever it contains. Like for example, if it contains proteins or if it contains glucose, if it contains the like lipid tissues, etc., lipid particles, etc. All these things should be steadily released into the circulating blood. Then it should form a fiber so that the bowel evacuation will be clear. So there is bulk formation in the stools, and then we see the evacuation, regular evacuation of the stools. So this is possible. This was not prevailing in the ancient days because in ancient days, in the diet habits, they used to incorporate millets in the regular food. They used to incorporate consumption of millets in their regular food. So incorporation of the millets in the regular food, say once in 3 days or 3 days in a week or once in a day or once in a week at least, will have a beautiful effect because the millets have a very important property of undergoing digestion slowly. So when it undergoes digestion slowly, the individual will be sturdy and there is no hunger. There is no immediate hunger. As we see, if we consume rice, our hunger will be temporarily satisfied. But in few hours, again, there is longing for intake of food. But if you consume millets, it is not the case. Millets get digested slowly, and at the same time, the contents of this millet. So millets normally contain fiber, they contain trace elements, they contain all essential vitamins, they contain iron, and at the same time, they contain proteins, which are essential for building up of anabolic activities. So millets should be practiced. So in our nutrition, we should make a point to see that we adopt millets. Out of these millets, the most important millets include, that is the pearl millet, then finger millet. Finger millet is already in practice. Then foxtail millet, kodo millet, and barnyard millet. These millets, when consumed, they provide rich proteins and at the same time they provide trace elements, adequate trace elements, and at the same time they provide minerals and essential vitamins and iron. So with this, the functional integrity of all the structures in the body are set right, and there is adequate time for these metabolites to enter into circulation, and they are being readily utilized and they are being readily cleared off. So nutrition forms 50% of our management. So always an attempt should be made to see that the food habits are being introspected, and after thorough introspection, we have to fix the food. The food should be suggested. If the individual practice the food habits, then more than 50% of his ailment comes under control. So you have to practice intake of millets. Millets forms one of the most important foodstuff, which is very essential for our present day lifestyle. Then we see that the practice of dinacharya is not appropriate most of the time. So improper dinacharya could give rise to the diseases, which run in a long course. For example, if we don't practice Gandusha, isn't it? Gandusha, Anjana, Nasya, if we don't practice regularly, then there will be Kapha Prakopa. The Kapha Prakopa is not congenial to the eye, isn't it? It is said in Samhitas that Kapha is always a threat to eye. Kapha is always threat to eye. We should see that the Kapha is eliminated frequently. Kapha should be eliminated frequently. So therefore, we should see that the Kapha is eliminated out. Otherwise, it gives rise to all sorts of problems. So to eliminate the Kapha, there are various techniques and procedures. Say the most important technique includes the Shodhana Karma. Shodhana Karma is very important. Then after Shodhana Karma, subjecting the eye to different types of Kriya Karmas, which eliminate the eye, which eliminate the Kapha. So there are various Kriya Kalpa procedures. Modification of the ingredients of these Kriya Kalpa procedures will eliminate the Kapha from the eye. So Kapha should be eliminated out. Then we come on to the next important factor, that is the environment. Environment is posing a lot of problems in our present day-to-day affairs. We see that the most commonest environmental hazard that we are coming across is the air pollution. Air pollution has become or has reached to such an extent that one cannot move about in the streets. So within few hours of his exposing to the environment, there is burning sensation, asthenic properties, redness of the eye, itching, and burning sensation in the eye. So exposure to this polluted air is one of the most important causative factor. We see that it has become unavoidable. It has become unavoidable, and we should learn to live in this polluted environment. That is because vehicles cannot be avoided. There are hundreds of vehicles running every day, added to the existing vehicles. Every day, hundreds of vehicles are entering. So the exhaust of this or the smoke coming out of these vehicles will contain harmful gases and toxic gases, which result in the ailments of the eye, the nose, and the respiratory system. So these three are affected at large. So these pollutants, air pollutants, and postulates present in the air will give rise to good number of allergic conditions. It starts from the children. School-going children will have plenty of allergic manifestations, and it is very difficult to manage this condition also, because when you treat them with proper medication, there is control. But again, it manifests because you cannot avoid, you cannot abstain yourself from this environment. So unless the environment is cleared or environment is made free from this pollution, we cannot come out of this. Isn't it? So for air pollution, always you must grow trees. There is lack of trees. There is deforestation. So deforestation is one of the most important causative factor, because all the rural areas are gaining momentum and becoming developing into cities, as a result of which a lot of construction work is going on. So with the increase of this population, roads have to be widened. Many of the trees lose their existence. Because of this, what happens? The oxygen concentration is reduced, and at the same time, the toxic gases percentage in the air increase. So this should be avoided, or this should be overcome. This cannot be overcome in 1 or 2 days, because you have to grow trees. When you cut a tree, that is, cutting a tree is very easy. Within few hours you can cut the tree, but to grow a tree, it takes not less than 5 to 7 years. 5 to 7 years. There are many trees. There are many trees which emit fresh oxygen. Fresh oxygen. If you go to any park areas or any gardens, etc., you feel as if you are entering air-conditioned media. That is because these plants will always leave oxygen. Oxygen concentration will be very high when the trees are in plenty. Because we need oxygen to the greater extent. When you just combine the oxygen need of an individual with that of the population, the equation, that is the oxygen resulted from the trees, the oxygen trees resulted in the environment, and the population growth and the population need, it is reducing gradually. That is the imbalance. The imbalance is increasing steadily. So because of this steady increase in this imbalance, we are susceptible to good number of diseases, especially the respiratory diseases and the ocular diseases. So we see environment is one of the most important contributing factor. Then in the environment, water pollution. Water pollution is again a big problem. See, the technology has improved to such an extent that we are getting filtered water. So many a times we see in this filtered water, many of the minerals and trace elements which are essentially required for our health are being deprived. This water is deprived of that. The ancient way of filtering water is very appropriate, wherein the solvents in the water, which are essential for the body, are being untouched. Only the other ingredients are being precipitated and they are being eliminated. So when you allow the water to pass through sand, carbon, charcoal, etc., we see that most of the these solvents, or most of the water contents salts, which are not congenial to us, are being filtered out. But the essentials like trace elements, the minerals, and other important components of the water are being retained. So if you drink that water, you will be healthy, or you develop immunity against good number of diseases, isn't it? So this water which we consume, of course, the water may be devoid of microorganisms which are cause for the disease. That is okay, but still essentials like minerals and trace elements are being deprived. deprived, we are not getting that through this water. Water pollution is very important. Then for purification of water, chlorine is inadequately added, and many other things are used which are not congenial to our body, isn't it? See, this you can experience when you are taking bath with hot water. Hot water, you can see chlorine, fumes of chlorine coming out. You can inhale, and you can feel the chlorine irritation. So, improportionate mixture, improportionate combination of this chlorine, improportionate this combination of this many chemicals which are used to clean the water are not appropriate. They are not healthy. So water pollution contributes a lot. Then comes the soil pollution. We all know that soil is being polluted in number of ways. That is the fertilizers, chemical fertilizers and pesticides. The chemical fertilizers and pesticides act as poison. They act as poison. So there are number of diseases cropping out of this. We cannot pinpoint exactly what disease we are going to get out of this these toxic materials or these pesticides and other things. So along with this, there is garbage. They planned removal of this garbage, or there is no planned execution to clear up these garbages from electronic waste, from these gadgets, etc., which give rise to lot of soil pollution. And in fact, the plants are also getting the untoward or these toxic materials into their system, as a result of which the rice grain that we eat, the wheat grain that we eat, isn't it? The fruits that we eat, almost all of them contain some or the other unwanted materials, which can give rise to diseases, maybe in the eye or maybe in other areas. So that has to be controlled. That has to be controlled. Waste management is one of the most important thing that is essential. Then comes the iatrogenic disorders or the endogenous disorders. In the endogenous disorders, more often we come across with the iatrogenic disorders, metabolic disorders, autoimmune disorders. Likewise, nowadays we see the cropping up of autoimmune disorders, isn't it? Many of them are suffering from autoimmune disorders. So during our days when we were studying, the percentage of this rheumatoid arthritis or percentage of this autoimmune disorders were very meager. Very rarely we used to come across, say almost 1 in 200 cases that we examine. So thyroid problem, for example, thyroid problem has become so common that during our studies we used to get this thyroid problem like the goiter or hypothyroidism, etc. around again in the same manner, same proportion, 1 out of 150 cases. But nowadays you see thyroid has become a very common problem. Hypothyroidism or TSH value, increasing TSH value has become a very commonest problem. So these are all because of this pollution or because of the food grains, contaminated things or pesticides and other things which influence these things. So with all this, we should come out with the nutrition, or we should get ourselves free from the impact of all these influences. To come out from the impact of all these toxins, whenever we treat any chronic case, always we subject the individual for the Shodhana. Now we have come to know why Shodhana is essential. Shodhana is essential because what we consume, the pollutants from the soil, from the water, from the air, and then the endogenous causative factors which give rise to the toxins, onset of toxins, and many of the iatrogenic problems, that is steroid-induced problems, or the this anti-immune drugs which we are prescribing. Nowadays for autoimmune diseases, always we are giving the immunosuppressive drugs. The immunosuppressive drugs have their own adverse effect. Knowingly that there is adverse effect, still the individual is consuming it mandatorily. So that is giving rise to a lot of problems. So to overcome all these problems, whenever we think of any management, Shodhana is very essential. So to begin with, always when we come on to the treatment aspect, Shodhana becomes imminent. By Shodhana, we can see that the toxins accumulated in the tissue level or accumulated at cellular level, or at least part of it being eliminated out. If that is eliminated out, we think much of our problems are minimized and the treatment becomes easy and the medicine will have good influence or good effect on the system. Good effect on the system. So Shodhana becomes very important. So Shodhana, we see we are following seasonal Shodhanas. Though we feel we are healthy, Shodhana is not at all being carried out for years. And in some incidences, by some influence, we may go in for Shodhana, that is seasonal Shodhana, but that is not the case. How Shodhana is required? Now it is imminent. So Masadvayena Kartavyam Nasyam Shantam Yathavidi. So Masa Dvayena, once in 2 months. Nasya is very important. Once in 2 months, Nasya is very important. Likewise, Masatraye cha Kartavyam Itam Shantam Virechana. Once in 3 months. Once in 3 months, Virechana is essential. Virechana should be carried on. Once in 3 months. Then Masa Shakyecha Kartavyam Vantir Aushada Molataha. That means once in 6 months, Vamana has to be carried out. See how beautiful it is. Once in 2 months, Nasya has to be carried out. Then once in 3 months, Virechana has to be carried out. Then once in 6 months, Vamana has to be carried out. If this is practiced, I think all the environmental hazards and then the pollutants that we are coming across, and also we see the fruits that we eat, isn't it? A lot of preservatives will be there on the fruits, and lot of chemicals are being used. So these chemicals, even if we wash thoroughly, fruits are being washed thoroughly, some amount of it has penetrated into the substance of the fruit. So that when we consume, we are bound to have it. Effect of that will be, or that we are bound to have. So to overcome this, when we are in a position of in unavoidable circumstances, wherein we cannot purify the air, it is not in our hand, we cannot, the water pollution cannot be avoided, soil pollution cannot be avoided, but still you can avoid or you can keep the healthy state of the individual by this, by the Nasya Karma, then by Vamana Karma and Virechana Karma. Iyam Kadiyasi, Iyam Kadiyasi, Rakshe Netra Trayana Nirmitaha. That means it protects the eye. It protects the eye from all these hazards. Next important line of treatment is Basti. Many of our ocular practitioners, we concentrate only on the Kriya Kalpas, only on the internal medication, only on the socialists, and such other internal medicines. But it is not sufficient that when we go in for only internal medication, only Kriya Kalpas, purification is essential, as said earlier. Along with purification, Basti has got a vital role. Basti has got a vital role. So we should make a habit of practicing Basti in our Shalakya department, isn't it? So Basti, we all know that it is being a combination of good number of drugs. It is being a combination of good number of drugs. So the more number of drugs we induce in the Basti, the better will be the outcome. Because each drug, many drugs have their greater impact or selective treatment or selective action on netra and different parts of the netra. And many drugs have selective action only on thyroid. Many have selective action on the nerve sheaths. Likewise, the combination of different drugs in the Basti have variegated effect, which are very essential from the part of management of ocular disease. So Basti always gives rise to three important actions. One, it acts as Samshodhana, then it acts as Samshamana, and it acts as Sangrahana of doshas. So these three are very important. The excessive doshas, otherwise called as the toxins, or the resultants of ama, the ama that is accumulated, these should be cleared up. Unless you clear up, the treatment will not be that effective. So we have to clear up this. Doshas should be cleared up. So there are many references wherein Basti has been indicated. Basti has been indicated. It is not necessarily indicated for Chakshusha property, but it is also indicated for many of the systemic diseases. For example, we have Madhutailika Basti described by Acharya Shushruta. Madhutailika Basti, when given, it not only controls the diabetes mellitus, but it also has good effect on the complications of the diabetes. Madhutailika Basti is of utmost importance. Then Shushruta, once again, he has described Mustadi Rajayapana Basti. So this Mustadi Rajayapana Basti, again, he concentrates more on Prameha and its complications. Prameha and its complications. Madhutailika Basti and this Mustadi Rajayapana Basti, both of them have got Chakshusha property on one side, and at the same time, causative factor for these Chakshuvikaras which arise from Pakvashaya are being cleared by this Bastis. Similarly, Acharya Charaka has described Sthiradi Basti and Panchatikta Basti. The Sthiradi Basti and Panchatikta Basti again have very good Chakshusha properties. They have got very good Chakshusha properties. Here, Chakshusha property means not necessarily the improving the vision, but the abnormalities and the causative factors involved in the samprapti and manifestation of disease are being alleviated. They are dissociated and they are being alleviated. And the movements of the dosha, the quantum of the dosha, and the qualities of the doshas are being restored. They are being restored. So therefore, we can go in for these bastis, different bastis. Say, for example, in Ashtanga Hridaya, we have Balao Patoladi Basti. Bala Patoladi Basti. So Balao Patoladi Basti is effective in these disorders resulted out of Kapha and Pitta. Whenever we suspect any Pitta and Kapha Vikaras, then we can go in for this Bala Patoladi, and then Balyadi Gunavasti. In Ashtanga Hridaya, we have Balyadi Gunavasti. So judicially, after taking into consideration the dosha that is involved and actual pathogenesis that we see, we have to involve or we have to incorporate these bastis, different bastis. So these basti in an adequate dosage, in a judicious manner, when applied, gives very good result in combination with internal medication and local kriyakalpas. Local kriyakalpas. Then after Shodhana therapy, then we come on to the local treatments. That is Samshamana Chikitsa. In Samshamana Chikitsa, we go in for the different lepas, different Seka, and Aschotana, which we have already studied. Already you have come across in the first lecture or first presentation. So Tarpana, then Anjana, they are effective. Out of which I said earlier, in the early phase of the disease, early phase of the manifestation of ocular disorders, we always go in for Archotana and Seka. Archotana and Seka play a vital role. Then, when the disease attains Samavastha, or when it attains Niramavastha, then we go in for the application of Anjanas, then we go in for application of Uttapaka and other procedures. So, as long as the doshas are in some this Amavastha, then we have to go in for only Aschotana and Seka. Aschotana is the most preferred, then you can go in for Seka. And in the Amavastha itself, we can go in for external application of lepas. The lepa may be on the forehead, or the lepas may be applied over the lids. Then when the eye attains Niramavastha, then we switch on to the Anjanas. We see in our practice, most of the time we come across with Adimanta, for example. When we come across with Adimanta, we are of the opinion that it is glaucoma. Now, Adimanta, described in classics, is always confined to the congestive type of glaucoma, because all the salient features described under different headings of this Adimanta are more akin or more applicable to the congestive glaucoma. the line of treatment, including the line of treatment, symptom pattern, line of treatment are akin to the this congestive glaucoma. So in congestive glaucoma, these treatment definitely work. These treatment definitely help, because in congestive glaucoma we see there is avarodha. It is a avarodha genericaris. Whenever you do Chalukya Acharana, whenever you do Raktavisa, whenever you apply medicines, or whenever you do these Shodhana procedures, we see avarodha is released. When once the avarodha is released, the pressure automatically comes down, and the pain and other conditions definitely come under control. But in the open angle glaucoma, the samprapti differs, the doshas involved, and the mechanism of the disease, manifestation of the disease, lakshanas differ. The same treatment, or line of treatment, cannot be applied there, isn't it? Say another example that I would like to give is in night blindness, for example. In night blindness or the Shleshma Vidagdha Drishti. So we have Pitta Vidagdha Drishti as well as Shleshma Vidagdha Drishti described in classics. Both the conditions are reversible. This is very important. Both the conditions are reversible, manageable by medicines. Manageable by medicines and manageable by other Chikitsa Sutras. So in night blindness, he says, simple usage of Maricha rubbed in dadi and applied will give wonderful results. So the reversible or a reversible night blindness is nothing but it is either because of two important facts. One is deficiency. Many times we see the night blindness resulted out of vitamin A deficiency is reversible to some extent if it is established in early stages. It is reversible. But we have night blindness which is not connected with vitamin A, but it is connected with other internal problems, other internal disorders. That is not possible. That is not possible by the routine medications that we use. Isn't it? In classics, we have good number of description. For example, you can use the Kanapi Yoga. The Ajayakriti is taken and a window is made into it. Pipali is put inside. That is, Pipilikana is put inside. Then again it is sealed, and then we keep it in boiling water under Dola Yantra. Boil it well. When it becomes hard, we remove that, and then the window is opened. The pipali which are inside are being drawn and placed over the kalva, and then crush it, and juice is extracted. In the juice, this pipali is rubbed thoroughly, and after rubbing that, then vartis are made, dried in shade, and that is used. It is called as Kanapipali. So this is rich in vitamin A. Because this is rich in vitamin A, in reversible Shleshma Vidagdha Drishti, that is purely vitamin A deficiency, the results will be appreciable. Result will be most appreciable. Whereas if it is due to other causes, it is difficult. Sometimes we see the day blindness and the night blindness as a result of lens problems, lenticular problems. See if there is a nuclear cataract, or when there is corticular cataract, we see the dim light vision is affected grossly. When we assign it as almost like night blindness, then if it is a nuclear cataract, if it is at the center, when it is affecting the central visual areas, then we come across with day blindness, isn't it? Now we have good number of medicines which are effective in alleviating these degenerative changes in the lens. See, if it has not passed the immature stage, we can try with good number of medicines. Single drugs will do. For example, the brinjal. A brinjal plant, when it gives the fruits, then it will die. So the roots may have to be collected from the brinjal. So thick roots are collected. You dry it in shade. When it becomes dry, then make into small pieces. Pound it well. Prepare fine powder. Prepare fine powder. Mix it with water. Prepare anjana, apply it. You keep on applying at least for 4 weeks. You see very good changes. If you want early changes, then these roots, powder collected from these roots, you can rub it in Apamarga Pattaswarasa or Apamarga Mulasurasa. Rub it thoroughly, again prepare for this, dry it in shade, and then use it as Anjana. It's very potential and very effective. So we have reversible procedures, reversible night blindness, reversible day blindness, which may be due to lens changes or it may be due to deficiency. If it is due to deficiency and if it is due to lens changes, the result will be very good. And in classics, this is what is assigned, because in classics it is said that it is reversible. It is reversible. So likewise, we have to understand the Samprapti, understand in detail the consequences and the outcome and the affected parts. And depending upon that, we have to switch on to the treatment. Because one single treatment or one type of treatment may not help much. In many of the chronic conditions, for example, one question was asked, that is pigmental degeneration. So in night blindness resulted out of pigmental degeneration is not reversible. It is not reversible because many a times a degeneration in a nerve tissue is more often not possible to reverse. So in irreversible conditions, however, we have to prevent. We have to take steps to see that it should be prevented, or further progress in the disease should be arrested. So to arrest further progress in the disease and to keep these viable areas do not undergo degeneration, there are some procedures. These procedures, when you incorporate, and definitely you will have a result. So suppose if the vision is somewhere around 6/36 or 6/24, you can retain that vision. Further deterioration can be prevented, because in pigmental degeneration we see there is progressive degeneration. The progressive degeneration goes to such an extent that in few years you will end up with binocular vision. Then after binocular vision also, the slow process is going on. Ultimately you will be made to learn braille. So such being the case, if you prevent the further progress, it is as good as managing the condition, isn't it? It is as good as managing the condition. So in all such conditions, we should think of ways and means to prevent and protect the situation, protect the further progress of the disease. So we very commonly use Yerandamula. Yerandamula is one of the important drugs. So Yerandamula and Yerandaphala and the tender leaves, all these three are mixed, dried, made into powder, mixed very well, and then they are rubbed in kshira. They are rubbed in kshira, that is gokshira, and used as osteotomy. Similarly, for osteotomy, single drugs like Jati Patra or Jati Pallava. Jati Pallava is very effective in good number of external ocularities, that is the anterior segmental problems. In number of anterior segmental problems, the Jati Pallava is very effective. Daru Haridra, single drug Daru Haridra osteotomy is effective. Then Amalaki Surasa, near Amalaki Surasa. You take Amalaki fruit from the tree, then make small cuts. Then you will get drops coming out, the juice, fresh juice coming out. This juice is very effective in the incipient cataract. It is very effective in incipient cataract. It is very effective in corneal abrasions, very effective in conjunctival disorders. So, a individual drug, you can use Yerandamula, you can use Jati Patra, Jati Pallava, then you can use Shigru Pallava. Shigru Pallava is also a very potent and effective medicine. So, single drug osteotomy is of utmost importance. So, you can use in good number of drugs. Then comes Seka. Seka, again the Shigru Pallava Seka. It is universal, it is effective in all eye diseases. When you don't have any medicine, isn't it? Go for Shigru Pallava, collect the Shigru Pallava, pound it well, and use it as Seka. Or Rasanjana Seka, Darvi Seka. Darvi Seka is again very effective. Darbiseka is very effective because it alleviates Vata and Kapha. And at the same time, it is a palliative of Pitta. All the Tridoshas are being contracted. So Darvi Pallava may be used. Then we use in all the inflammatory conditions of the eye, isn't it? In all the inflammatory conditions, we use Shadanga Gukulu. Shadanga Gukulu is a very effective medicine which is used in Jattodagata Vikaras. If there happens to be any inflammation in the ear, any inflammation in the throat, any inflammations in the nose or in the eyes, in all these inflammations, best drug is Shadanga Gukulu. Shadanga Gugulu contains 6 ingredients along with the Gugulu. It basically contains Triphala. Along with Triphala, Vasa Patra, Nimba Patra, and Patola Patra. So the churna of Vasa, Nimba, Patola, and Triphala form 6 ingredients, Shadangas. These are made into fine powder, and then to this through this powder, infusion is prepared, kashaya is prepared, and this kashaya or the ganasara is used along with Gukulu, pure Gukulu, will give very good result in all the inflammatory conditions of the Jattodagata Vikaras. Not necessarily the eye. Many of the eye diseases, it is exclusively indicated, but along with eye, you can also use this in ear problem, nose problem, and such other inflammatory conditions of the oral cavity. Then comes the Mahavasadi causation. We have, when you don't know anything, or when we are not in a position to diagnose properly, when there happens to be inflammation, when there happens to be hemorrhage, when there happens to be collection of fluid, isn't it? It may be uveitis, it may be retinitis, or it may be macular degeneration, or there may be leakage in the macula, etc. In all these conditions, important drug is Mahavasadi because I use this extensively. It's just like a broad spectrum antibiotic. So use this Mahavasadi early morning. It contains 16 ingredients as per your Ratnakara formulation. All the 16 ingredients have variegated and good effective action. They reach the target. They reach the retina and bring about very good effect. You say there may be vitreous hemorrhage, there may be cystoid macular degeneration, or there may be cystoid macula, or hemorrhages, microhemorrhages, isn't it? Or uveitis. Above all, uveitis very, very important. Non-specific uveitis, or uveitis may be resulted out of this autoimmune problem. So uveitis resulted out of autoimmune problem is a very dreadful disease, a very problematic disease, which repeatedly gives rise to inflammation of the eye, blurred vision, photophobia, isn't it? And multiple joints involved. So simple way to manage this is Mahavasadi. I give Mahavasadi, and along with that, you just give this Amrita Surasa, Amrita Kanda Surasa with Shunti. Amrita Kanda Surasa with Shunti and Rasna Yarandari Kashaya will give very good result. It pacifies the joint problem and at the same time the ocular problem. So the vitreous hemorrhage which give rise to blurred vision. The individual complains as if he is seeing through a oil paper. So or through a cloth. So such visions usually come under control within 7 to 8 days. Within 7 to 8 days, the vision, the clarity, the sharpness improves. So Mahavasadi is again a very good and a very important drug. So Shadanga Gukulu and Mahavasadi. Then we have many simple remedies. For example, the other important conditions which we come across include the lens problem. Lens problem forms most commonest disease in the OPD department. So starting from presbyopia to that of a mature cataract, we come across with series of conditions associated with the lens change. That is what is literally assigned as Drishtivika. So here we have plenty of medicines, single drugs we have, out of which Matsyakshi is again one of the most important drugs. Matsyakshi is one important potential drug. So Matsyakshi daily consumption, that is a big glass ball size early morning, big glass small size, Matsyaksi along with Amrita. It is consumed daily. Then the complications resulted out of hypertension, complications resulted out of diabetes, isn't it? And complications resulted out of glaucoma. Usually stops. There is no further progress. And in fact, 15 to 20% improvement will see by this usage. This Matsyaksi can be used externally also. It can be used in various diseases, of which the most important being in the lens changes. In the lens change. So in the lens changes, if it is in incipient or integument stage or in the immature stage, usually Matsyaksi Surasa is combined with Apamarga Mudaswas. So Apamarga and Matsyaksi are combined and they are used as osteotomy. They are used as osteotomy. Similarly, you can go for bitter gourd seed pulp. The seed pulps of bitter gourd can be used and it is mixed with tilathaila. It is mixed with tilathaila or rubbed in tilathaila and then applied. Rubbed in tilathaila and applied. And the best potential effect that we get is out of the Apamarga molar and this brinjal root. Brinjal and Apamarga root, you can collect fresh or you can collect the dry one. And this powder should be mixed and rubbed with shiguru pallava. Mixed and rubbed with shiguru pallava. This we are using in our shiguru pallava will give very good result. Will give very good result in lens changes or in lens disorders. So similarly, this white onion juice is exemplarily used. What we do is the white onion juice is taken in a cup and then the vartis are prepared, wigs are prepared out of this sterile gauze and it is dipped in that for 15 to 20 minutes. After dipping that, it is taken out and it is dried. So likewise, when it is completely dried, again you dip it. So 7 times it is being carried out and after 7 times, when it becomes dried, it becomes very hard and tough. So this you can burn directly and collect the masi. Masi can be collected, or you can just keep it in tilathaila and lit it in a mud lamp and then collect the masi. So this masi is taken out, collected. You will get plenty of masi. It is collected and it is made into fine powder. You mix this with a butter which is salt free. If you want to preserve it for a number of days, you can just mix it with butter, salt-free butter, prepare anjana, and then store it in small steel boxes and distribute to the patients. So those who have presbyopia, they can use it in the form of anjana daily. We will get potential changes. Then in incipient or in integument stage also, we find that this is very effective. This is very effective. Then there are many other cases. For example, if you get blepharospasm, many a times you get blepharospasm. So I have come across with conditions where there is blepharospasm. Normally in our practice, we come across with blepharospasm because of involvement of the cranial nerves. Because of involvement of the cranial nerves. And then involvement of the oculomotor nerve. So there are many incidences wherein there is inflammation of the oculomotor nerve. The inflammation of the oculomotor nerve always gives rise to granulomatous changes. These granulomatous changes will have a tamponade effect on the oculomotor nerve. So because of this, we see the eyeball movement becomes sluggish, and more often the eyeball movement may not be possible voluntarily, and there is lid drop. There is lid drop. So this may happen, or this could happen. Blepharospasm can happen in other conditions also. So simple medicine is take half tola of this garlic, pound it well, and mix this with a glass of milk and ask him to drink in the morning regularly. Within week, you see the lid voluntary control of the lid movement is achieved. Voluntary control of the lid movement is achieved, and the inflammations also come down. Lashana is a very potent drug which has got very good effect on the neurolemma. It has got a very good effect on neurolemma. And suppose if there are any nodules or cystic changes which bring about tamponade effect on the oculomotor nerve. So we come across that 2-3 cases I have come across wherein because of this cystic growth, the growth was to the extent of 3.3 mm. So this we have treated with simple medicines. So you just give Shivaguti. Shivaguti is one important thing which can be universally used in all types of tumors. Whenever you suspect any granthi, Shivaguti, and then this Navakagugudu, combination of Shivaguti and Navakagugudu. So just internal administration will clear that. In the initial stages, you can also combine this with Bharatwa Chintamani Rasa or Yogendra Rasa. Then we see within 1 week, the boy was able to open his eyelid. And subsequent MRI was taken. So the case was treated in Medical College Research Center, Government Medical College Research Center. And then after this treatment, when a subsequent report was taken, this 3.3 into 4.3, the nodular cystic swelling which was seen, which was assigned as fibroma, cleared completely. And there is no Ardhava Vedaka in the point. Lid movements are free, eyeball movements are free, and he is attending the classes. So from past 3 months, there is no recurrence. So likewise, you just go through the Sampradaya, find out the disease and use it with simple medicaments. Simple medicaments will have a wide range of it. With confidence and faith when used, definitely you can have a good say. I think I've consumed a lot of time, more than the time assigned to me. Anyway, once again, I thank the organizers for giving me an opportunity. And indeed, I'm sorry because I could not present these slides because I am very busy with some other things, also preoccupied, so I could not present the slides. Anyway, if there are any questions, welcome.
Thank you very much, sir, for your enriching speech. We have got many practical aspects in treating most of the eye diseases, and definitely we will put all these points into practice, sir. And I'm very thankful to you, sir, because you have spared your valuable time, even though you were very busy and you had insisted that you had not able to do this lecture, but then too, I was insisting you to come at least for 1 or 2 hours, and you have spared your valuable time. Thank you very much, sir. And future also, we would like to invite you for such occasions, sir. Thank you, sir.
Sure.
I think we can take
you.
1 or 2 questions if they are there. Or Shravani, we have any questions?
Thank you so much, sir. Sir, one question is from Trilok Verde. What is the treatment of floaters in eye?
What is the treatment of?
Floaters.
Repeat, madam. Repeat.
Treatment of floaters.
Floaters, sir. Floaters.
Floaters is a symptom. Floaters will be seen in good number of conditions, isn't it? Floaters are seen in good number of conditions. So in floaters also, what we do is external application. Tarpana many a times relieve the floaters. Tarpana, for instance, many a times relieve the floaters. Tarpana with Mahatriflakrita relieves the condition, relieves the floaters. Then floaters we also give internally this Mahasadikota. Mahasadikota when given, the vitreous floaters normally get disappears. And then we also use this Haridha Janjana for external application. So these 3 procedures will clear the floaters. So floaters basically depends upon the causative factor. So it may be seen due to refractive errors. Many a times it is seen due to refractive errors when Tarpana has got a good effect. Sometimes it is seen because of the vitreous floaters, which usually disappear with the Anjana, application of Anjana. And sometimes if there is retinal disorders, which is the cause for floaters, then we have to go into the multiple treatment. So we have to prepare a powder, external application of powder. So external application of powder comprise of Haridaki, Amalaki, musta, raktachandana, and kachora. These things are mixed together and applied. Taste of it is applied, and till it is dried. Till it is dried, it is allowed. Then the internal medication. Internal medication of primarily with Mahasadipatha Charna. I prefer Mahasadipatha Charna. And if there happens to be any edema of the this retinal edema giving rise to this floaters, then we going for addition of Patya Punarnavadikvata from Sahasra Yoga. Sahasra Yoga will relieve the edema. Okay, next. Next question.
Thank you so much, sir, for very informative lecture. We come to the end of first session. I thank both the speakers for sharing their knowledge. I thank all active participants for being present for the webinar and sparing valuable time. Thank you so much. For tomorrow on 20th November, the webinar will start at 2 p.m. We hope we will meet again for enriching our knowledge. Thank you so much all. I once again thanks our Honorable Director Sir for sparing their precious time and addressing our gathering. I also thanks our HOD Ma'am Professor Shamsa Fiaz for organizing the event in a planned and smart way. I also thanks all HOD, all teachers, staff of NIA and scholars from various colleges for their active participation. Thank you all. Thank you so much.
Once again, thank you very much. Even Dr. Rajesh Pawar is here with us, and Sangeeta Madam, and Shanta Kumari Madam, and of course Venkatesh Sir. Sir, thank you for sharing your valuable time with us. Sir. Thank you, sir. One and all. Okay. Okay, Shravani.
Yes, ma'am.
Anita. Okay, ठीक है. अच्छा होगा. How many viewers are there right now?
27.
So Facebook and all. We have to see, no? Okay. We'll disconnect. Thank you for coordinating this program.